Hello, and welcome back to our patient education series on surgery with young lung cancer. I'm Leah. I'm one of the co-founders of Young Lung Cancer Initiative, and I have my friends here with me that you met on the first episode to go on to first episode was about before surgery. Now we're on the day of, and this format's going to be a little bit different just because we agree that we don't really know what's going on during surgery. We know how long we were under, how long things last, but this should be a shorter episode. So I want to welcome back all my guests. Ashley, because yours is a little different because she was stage 1, as you remember, and this is considered curative for her. She just monitors her disease after that. So let me ask you this. How long do you think it took, or did you know how long your surgery lasted?
I believe it was 3.5 hours.
Okay. And remind us what you had done.
I had 2 procedures. So I had a left lower lobectomy with the RATS procedure, Da Vinci assisted. And then I also had a chest wall mass removed on my right side.
Okay, perfect. Thank you. And Terry, I'm going to ask you the same thing for the RATS procedure. So if you could just share kind of like how long your surgery lasted.
I believe it was right around 4 hours. And it was also rats. I had a lower left lobectomy, a pleurectomy, and removal of 33 lymph nodes.
So lots of lymph nodes removed in that pleural lining. So that would probably reason why it would extend that surgery time. Haley, you had the open procedure done. Do you recall how long your surgery lasted?
Mine was about 4 hours as well. And
Okay,
I
4
also had
hours.
open top pleurodesis done.
Okay. And then for me, it was a little bit longer because of that radiation scar tissue, which was expected. They told me it would be a longer procedure. Seems like you'd like to say, oh, this was a normal situation, but no situation is normal or typical. So I would say it's safe to say between 3 and 4.5 hours would be how long surgery would last. Okay. Let's see. I am going to ask Mariah this. Do you know if you had a nerve pain block when you had surgery?
I did. And I wonder if that was why I felt more pain like 2 months after the surgery when I was home around 4th of July weekend or holiday and couldn't really get a hold of anybody because it was really bad. But yeah, I had a nerve block.
Okay. So for those of you watching, a nerve block is put in during surgery and it just helps. It's supposed to help with the pain, like manage pain when you're first coming out of surgery and they're getting situated and the inflammation is worse, it's swelling, all those kind of things. So Dr. Antonoff does do a nerve block to help with that pain. Ashley, did you have a nerve block? Do you know?
I don't know. That's a great question. I hope I did. It sounds like it would be nice.
Well, yeah, a little added bonus. What about you, Lexi? Did you have a nerve block or do you know?
No, I did not. I did not. I was asked prior to surgery for permission to, if something didn't go as planned and they needed to open me up, could they use a nerve blocker? And I said, yes, I give you my permission.
Terry, did you have a nerve block or do you know?
I don't know for sure, but I can only assume that I did not because I was in an extreme amount of pain. When I got home, lots of nerve pain. It felt like my skin was on fire. It hurt to touch my skin. It hurt when there was nothing touching my skin. So I'm thinking no.
So maybe we should add that to the list of questions you ask as your pre-op visit, like, am I going to have a nerve block? Because I do think that does help manage pain, at least the beginning, if nothing else. Okay, let's talk chest tubes. Okay, so everybody gets a chest tube. You get a chest tube, you get a chest tube, you get a chest tube. So Lexi, could you explain where your chest tube is placed?
Yeah, so my chest tube went in through the side and then like snaked up to the top of my lung and or top of my cavity there, and it was insanely painful, excruciatingly painful, I will say. I'm so happy with my experience in Northwestern. It was great. The only thing that I was not happy with during the procedure, or I guess just right post-procedure while I was in the hospital, was my pain management. And I did talk to my palliative care doctor about that after the fact, and she had said that there had been a trend in sort of over treating with pain over, a number of years. And they're sort of course correcting that a little bit and possibly like too much. So there's like an overcorrection and wanting to, not give out too much pain medicine, but now it's, maybe so. And so she and I had talked and I said, for me, it's what it is. It's over and done. But for the next person, this was unbearable, quite frankly. So I think what I kept saying was in the hospital, I'm in pain, I'm in pain, I'm in pain. And what I think I needed to say is like, call my doctor because I need I need something different than what I'm getting. And I think I had to be very prescriptive about what I needed to happen as opposed to just like saying the state that I was in. So that would be my advice there.
Yeah, pain management is kind of tricky and individualized, and some people say the chest tube is more of a bother than the actual incision. Other people feel different ways. Let's see, chest tubes. Haley went home with her chest tube. So Haley, do you care to explain just why that had to happen? I think I had an ear leak. I know you did. There's several of us that's common. So if you just want to like summarize that maybe.
Yeah, so I don't know if it had anything to do with at diagnosis had a malignant pleural effusion. I had 4 thoracentesis done before I had a pleurax placed in December. And I was still draining it. Like I drained every day until probably a month before surgery. And then I was every other day and I was still getting fluid. So I don't know if my prolonged air leak had to do with that and having that pulled during surgery and having a talc pleurodesis or not. But I had surgery on a Friday and by Wednesday, I still had an ear leak. And since we were both medical, she was like, I'm comfortable with sending you home with this chest tube if you're comfortable with it. So I went home, flew home fine, no issues at all with that, with the chest tube for a week. And then flew back, saw her in office, had imaging done before they did a test to see if the chest tube was leaking air in the office during the appointment. Pulled it in the office. It was super easy, wasn't bothersome at all. And then had a repeat chest x-ray right after just to make sure everything looked good before I got back. And I wasn't able to restart my Tagrisso until after they pulled that chest tube, a week after discharge.
That's a good point to make. That was the same case for me. I had an air leak. I ended up having a talc procedure done where it's a closed pleurodesis. Basically, they put talc into the chest tube, and then you have to flip over and flip over and flip over for 2 hours to kind of coat things and seal it in because of that air leak. But to me, the pulling of the chest tube out is not nearly as bad as you think it's going to be. It's the end while it's in. Because at first, when you come out of surgery, you're hooked to a vacuum that's a little bit stronger on the wall. So you're really limited to what you can do. Then like within 24 hours, they like to put you to the Trilogy machine, which you're carrying all your fluid around with you where you go. And you're so concerned about pulling that chest tube out because you can see where it's kind of sewn in an X fashion into your side. And that for me was the worst part, was the chest tube. Unfortunately, I had a chest tube at diagnosis. Here's a little numbing spray.
Pleurax placement was way worse than my chest tube with surgery. And I did have to do, because I had it in after, I did have to do my own dressing changes at home, like with taking a shower and whatnot. Basically, it was like you can hop in the shower, keep your bandage on, sure that site stayed good.
Yeah, so it's just a little bit more work for sure. So you can expect a chest tube. That's the moral of the story. None of us loved having one, but we were all glad to see it go. Mm-hmm. But that is something that you can expect with surgery. So here's the big question, because I think this is so fascinating. 2-part question a little bit. How long did you stay in the hospital? And then did anyone stay with you, or were you by yourself? In some places, I know you even have a roommate when you're in the hospital. So that would be really awkward, I think. I did not have a roommate. So Ashley, how about you? How long were you in the hospital, and were you by yourself? Did you have somebody stay with you?
I was in the hospital for one night. It was hands down one of the worst nights of my life. And I was alone. I was not allowed to have someone spend the night with me. And I don't know, maybe I could have pushed back. I just kept asking the nurse how I could get comfortable. And she just said, you can't with the chest tube. So I had a very similar experience to Lexi. And I would push back if you could have someone there just to hold your hand. It's a rough first night and it gets exponentially better. I promise.
One night is pretty amazing though.
Yes.
So that's awesome. Terry, how long were you in the hospital, and did you have anybody stay with you?
Hospital for one night as well. My husband stayed with me, and my chest tube came out directly after surgery. So I didn't have to sleep with it. So I feel like I got decent rest. I was on some painkiller. I felt like I slept and checked out the next morning.
Pretty amazing checking out the next morning. Mariah, how about you? How long were you and did anybody stay with you?
My surgery was on a Tuesday. I was in the hospital till Friday to stay at the Rotary House, which is the hotel connected to MD Anderson, till the following Thursday. But I had lost 2 liters of blood, so I needed blood transfusions. I didn't have anybody stay with me because I was fine sleeping with all that blood loss. I remember texting Bianca. I was going through my texts before this. That I was like, I am afraid of sleeping to our like not being able to wake up because my eyelids were so heavy, my head. But anyways, after that transfusion, I was feeling better, but I had an air leak as well. So at the Rotary House, my mom stayed with me, but before that, it was just me in the hospital, and then my husband coming back, and he flew back to North Carolina with the kids, and my mom stayed with me.
I know at MD Anderson, they aren't particular about how many people that stay with you, which I guess is nice. Okay. What about walking? People are like, oh, can you just lay there because you've got this chest tube? Kind of, how did that go? Let's see, because some of you are just speedy getting those chest tubes out. I'll ask Haley, since I think she probably had it the longest. Obviously, you walked to the airport, but when did you first walk?
I got up and walked that evening because my surgery was first thing in the morning, and that was kind of a big deal. As having a background as a nurse, is you always hear like get up and walk as soon as you can. That's going to make you feel the best. So if they told me I need to take 3 laps, I was taking double that around, and I was asking like, can I get up? Can I walk? And the staff and everything was great. So I would just suggest walking as much as you possibly can. It didn't help my air leak completely, but it did help some.
Yeah, my air leak was still an air leak, and I walked all over that hospital. I went to the gift shops, the restaurants, in my pajamas with my little thing. But I will say I was able to walk through the airport in Houston, where I know some people have said they had to have a wheelchair, and I'm sure because I was walking and walking and walking and walking is probably why I didn't need that extra assistance. In that same vein, there are certain things that you want to do. Obviously, we're walking to improve our lung capacity and breathing. Lexi, can you explain what else you may be asked to do in the hospital to help with that breathing?
Yeah, they had, why am I blanking on the name? Spirometer. I'm going to blame that on chemo brain because I had chemo on Monday. Yeah, spirometer. So, that was just constant. Do it as much as you can. They also did breathing exercise, like a nebulizer also. We did that 3 times a day, constant, like keep doing that as much as possible. I did also have a leak, which is why I ended up having to stay 2 nights. And so they wanted to keep up with all of those breathing exercises, which is so important to continue to do not only in the hospital, but out of the hospital. But if I hadn't had the leak, then they would have sent me home the next day. So that's that other benefit of the rats is shorter hospital stays. So it would have been a one-nighter for me had I not had the leak.
Walking is super important. We've all figured that one out, didn't we? Plus, I think if you lay in bed for X amount of days, you're going to be really fatigued and weak as well. Okay, another question that we get all the time, and this will probably be our last question for today, is let's see. If you had a complication, do you feel like you were discouraged by that, or you're still thankful and hopeful since you had surgery? I know, Mariah, you had a lot of complications. Do you want to answer that question?
Yes. Yeah, I felt, I guess because it was around the 4th of July holiday, that I wasn't able to reach out to Dr. Antonoff or anybody. A nurse here and there would contact, but they weren't helping me with, you want some more pain medicine? And it's like, I want to know why this is happening and why, especially I knew Haley's experience was like the SNL alien abduction skit where everyone's like, they fed me bonbons. I was like, actually, it was just like awful. My recovery, I was literally felt like Frankenstein's monster. Just half of my body, completely head to toe, was just total nerve damage, could barely move my arm or anything. And so it was excruciatingly painful. I was on the oxy, much longer, and people are like, no, went to Costa Rica, right after this. What? And Haley went to Europe trekking the Alps and I'm still was in so much pain. So I just felt kind of in the dark after surgery. My local team helped me more, but Dr. Antoff, when I think she was out of town or whatnot, but she reached out and I felt better with that. But knowing because of the complexity, it was not, or I was out of the norm that it was so complex, but the pain was understandable because of that. But yeah, it literally felt like all of my organs had been removed and were placed back in and total just shot. But physical therapy helped a lot for me, and luckily learning that from Lindy, I wasn't originally suggested that until I brought it up in my appointments. And my physical therapist, he said around the time, it was like a month and a half after surgery, that was a good time, that my scar was pretty much almost healed, that was a good time to start the stretching and the exercises for me. But I don't know what I would have done without that and my pain medicine.
But still thankful, I'm sure, that you had that surgery.
I'm
I know
so
you said that before.
thankful.
Wouldn't change it.
I wouldn't change
But
a
yes.
darn thing. I told Dr. Antonoff this past time, I'll do it again and again and again. For I have my scans tomorrow. Happy thoughts, prayers. But I hope that I'm still currently in remission. So I'll do it again and again. You can tell me
That's
all
awesome.
the bad stuff and I'll still, yes, I'll do it.
Well, that will make people feel better knowing that. Well, I want to say thank you to all of you for being here again today to discuss the surgery part. And then our next episode, like I said, will be on what happens after surgery, after you're discharged, when you leave the hospital. So if you are watching, make sure to like and follow so you get updates on that next episode that will be coming out. And we will see you guys on the next episode. So thanks again.